Dr. Hrishikesh Deshmukh is a prostate cancer specialist in Pune, primarily working in the area of genito-urinary system pertaining to the senior population. He works at Institute of Prostate Cancer, which is dedicated to creating awareness about the disease in the society. HappyAging met Dr. Deshmukh at the institute and gained some insights on the subject.
Basically prostate is a male reproductive gland and its main function is important. Its main function is production of semen, so it is important when you are young for reproduction. Now, as you age, its function becomes less and less important, but it keeps on growing as part of the aging process. So every man after the age of 50 years will have some enlargement of the prostate, irrespective of the symptoms. He may not have symptoms of that enlargement, but he will definitely have some enlargement of the prostate. Now what happens when this prostate enlarges, it blocks the urinary passage, and that gives rise to many symptoms, like you need to push to pass urine, you have to go multiple times, the flow becomes interrupted. So many such symptoms develop because of the enlargement of the prostate. So primarily enlargement of the prostate is a part of the aging process. So that will happen with everyone, so you cannot prevent it. Only thing is 5% of the men will have cancer inside this enlargement, and the symptoms for cancer are no way different from a normal enlargement of the prostate. So you cannot differentiate between a cancer or a normal enlargement of the prostate just by the basis of symptoms. So you should be aware about these symptoms of prostate enlargement, which may give you a clue that you may be having a cancer inside the prostate. And there are no specific risk factors like which will tell you that you have a high risk or you will develop a cancer in future. Usually the cancer happens after the age of 50 years. Nobody gets a cancer before 50, that's for sure. So its age is the most important factor as far as this prostate cancer is concerned. Secondly, you can say that family history. So if somebody in the family has a history of prostate cancer, there is a 3 to 4 times more risk of getting a cancer. So that is second most important factor as far as prostate cancer is concerned. Some people say that some diet has a role, but diet has not been proven to have a very clear-cut role in terms of cancer. But usually it's best to avoid diet which contains more fats and less proteins. So that is something which should be avoiding as a normal healthy lifestyle rather than preventing a particular type of cancer. So these are the few factors which will tell you that there is a risk of cancer. Basically what happens when this prostate enlarges, it blocks the urinary passage, and the symptoms and signs they occur because of that blockage of the urinary passage. So main symptoms are usually they have to push to pass urine, straining to pass urine, the flow is interrupted. Sometimes you don't feel like you have emptied completely, you don't want to go again and again. So these are few symptoms. Some other symptoms like irritative symptoms like frequency, multiple times you have to go to pass urine. At night you have to wake up multiple times to get up to pass urine. Or sometimes there is an urgency, there is a strong desire to pass urine which you cannot postpone. So that is called as urgency. So these kind of symptoms, these are called as primarily irritative kind of symptoms. So such symptoms do occur in all men or with various level of severity. Some people have all the symptoms, some men may not have any symptom at all, or some people will have some symptoms. So whenever there are such symptoms, any of such symptoms, you should ideally do a checkup to rule out the prostate enlargement as well as rule out there is any risk of cancer inside the prostate enlargement. So as I said, this kind of thing, prostate problems usually do not occur before the age of 50 years. Okay. So ideally, everyone after the age of 50 years should go for a checkup for the prostate at least once, even if he doesn't have any symptoms at all. And especially those people who have a family history of prostate enlargement, family history of prostate problems, cancer, then they should do a regular checkup after the age of 50 years every year, at least once in a year. Now basically for a prostate enlargement, the simple common test that is usually done is the sonography of the abdomen and the prostate, in which we see the size of the prostate as well as any residual urine that is remaining behind after one passes urine, that is one. Number two is if you really want to rule out the prostate cancer, then there are two tests which are very much important and which are called as screening tests for the prostate cancer. So those are, one is a rectal examination and second is a PSA, that's a simple blood test. Now, rectal examination is the one which is done by a doctor, the urologist, who does this test, in which he inserts a finger in the rectum to check for the prostate. If there are any areas of hardness or irregularity on the surface of the prostate, then there is a risk of cancer. We need to rule it out by doing further test. And second test is a PSA, which is a very important test, which is a tumor marker for the cancer. So this PSA has a fixed level as per your age. So for example, if you are in your 50s, then the level should be less than 3. If you are in your 60s, the level should be less than 4. So if that level is high for your age, then there is a risk of cancer. I am saying risk of cancer because PSA sometimes comes high because of many reasons. So basically a PSA, a rectal examination and a basic sonography. These are the few tests that should be done routinely. Basically, prostate cancer is diagnosed by doing a transrectal ultrasound guided biopsy of the prostate. Now, this is a very specific, highly specialized procedure which is done through the back passage or rectum, and through the ultrasound we do a live recording of the prostate, and we take out multiple cores from almost 12 to 14 cores from various areas of the prostate to sample the prostate. There is nowadays, it's become very specific by doing an MRI prior to the biopsy, which is called as MRI targeted biopsy, which is done when your PSA is persistently high and you're still not finding the cancer. Then we do an MRI prior to the biopsy, and MRI gives us some areas which are abnormal, and based on that we do the biopsy. It's called as MRI targeted biopsy. That again depends upon the stage. So it is best to have if at all, we commonly say that if unfortunately one is going to have a cancer, then ask for prostate cancer, because it is one of the slowest growing cancer in the world. So what happens is that when you detect the cancer at an early stage, say stage 1 and 2, then a single modality and a definitive therapy can completely treat it, like surgery to remove the prostate, or radiation therapy to remove the prostate completely, or burn the prostate completely. So these surgery or radiation therapy to burn the prostate completely, this will cost you around say 1.5 to 2 lakh rupees in a normal setup, a good setup. If you go to an advanced stage, like stage 3 or stage 4, at that point it is not possible to completely cure the cancer. At that point, what we can do is we can control the cancer. This is true for any cancer. Any cancer that goes into stage 3 or stage 4, we cannot cure it. We have to control it. And for controlling, there are various therapies as far as prostate cancer is concerned. Like there is hormone therapy, there is chemotherapy, there is again radiation therapy, there is immunotherapy. There are many new modalities also coming up. So, if you go to an advanced stage, the treatment becomes a little more costly. And it's not a fixed criteria that this will cost so much of this thing, but you may require multiple sessions of chemotherapy, multiple sessions of hormone therapy, depending upon the fitness. You do a regular checkup and do a regular screening so that you can detect the cancer at an early stage, and that can prevent. There are a few things we may say that decrease your fat content in your diet, decrease the red meat content in your diet, or increase milk products into the diet, regular exercises. All these things can prevent to a certain extent the risk of prostate cancer, but it will not completely cut it down, that you will never get a prostate cancer if you don't take milk products. It is not like that.